Moving on now, can you imagine growing up in Soviet-occupied Afghanistan, escaping to a refugee camp in Pakistan, returning to Kabul only to flee yet again as the Taliban's insurgency grew? Well, that's just a part of Dr. Waheed Arian's life story, an Afghan refugee who moved to the United Kingdom at just 15 years of age. Dr. Arian went on to work odd jobs, all while pursuing his studies in the evening, eventually going on to study medicine at Cambridge. Well, earlier this year, he published his memoir, In the Wars, a story of conflict, survival, and saving lives. And just days ago, he was named as a finalist for the Best Doctor Award in the United Kingdom. I have the immense pleasure of welcoming him to the program today. Dr. Arian, thank you so much for joining us.
Thank you so much for having me.
Well, we've seen in recent weeks alone, tens of thousands of Afghans, of course, have been forced to flee the country following the Taliban's arrival. I was wondering if you could just speak a little bit to your own personal experience leaving the country, being a refugee elsewhere, and what do you think that host nations should prioritize in terms of guaranteeing safety and stability to Afghan refugees now?
Well, a few days ago, when I woke up one morning and received messages from my family members saying that the government is gone, it just flooded back the memories of the civil war in which I grew up myself, 15 years. In 1992, one morning we woke up and the ex-president Najib Allah's government was toppled. The Mujahideen came in and a civil war broke out, which was a street-by-street fight amongst various groups, because of which we had to flee from one part of the city to another and from one part of the country to the other, overstepping dead bodies, dodging bullets and rockets in the sky, going through the gutters just to find safety for us. Most of my childhood was spent in Silis, hiding from the daily rockets, the bombs, and the shellings. And that's where most of my education happened, because schools were shut, hospitals were destroyed, and the whole economy crumbled later on when the Taliban took over, to the extent that my father was driving a taxi for 6 months just to be able to afford a sack of rice. And the country was extremely isolated. So that is just a summary between 92 till 99 when I was in Afghanistan there. And these are the memories which flooded back to not just to my mind, but to the minds of millions of other Afghans who had witnessed that civil war and those times. And that was a huge humanitarian crisis. Sadly, now Afghanistan is going through a humanitarian crisis again. The country is isolated, food is running out, shelter is not there. And there are tens of thousands of people who are already displaced internally. We have seen the images. I've personally seen the images which are sent from my family members and the charity which operates Arian Teleheal throughout Afghanistan. We see that people don't have food. The hospitals are running out from medicine. So hence, it's so heartbreaking for me, one, to remember it myself, secondly, to be seeing my family members suffer, but also millions of other people who suffer as well.
And Dr. Arian, since you mentioned your charity, Arian Teleheal, which, just as a reminder to viewers, connects local doctors to clinicians around the world through smartphones and video chats, other technologies, I was wondering if you could speak to the fact that telemedicine obviously requires a certain level of infrastructure, access to the internet, access to adequate electricity, but it also requires, of course, a certain level of sociocultural awareness to treat patients properly. Can you talk about some of the things that you have had to adapt to ensure that telemedicine is compatible with Afghanistan's specific needs?
So when I became a doctor in 2010, one of my dreams was to give back to the people of Afghanistan, because I'd seen 15 years during a conflict in which I was born myself, so much trauma, so much misery, that I wanted to help in any way I could. I kept going back and forth to Afghanistan and helping in hospitals. And that's how I built a relationship with the doctors on the ground and with the government officials as well in the Ministry of Public Health. Then later on, I realized that there were so many other people in the UK and the national healthcare system, they wanted to help as well, but they couldn't go just to Afghanistan to take a leave because of various complexities and issues, such as political, situational, and so on. So I had to really think outside of the box what could be the solution for it. I came across telemedicine that was being done by big organizations such as MSF, Médecins Sans Frontières. And I thought that could be a solution. So I went back to Afghanistan and I was hoping that the government could help us with implementing the internet throughout these hospitals with big monitors, but they couldn't do any of that. So then I had to come up with another simpler solution, which was tapping into smartphones, which almost every doctor had, as well as social media. That was Viber and Skype. So people have been using that very, very freely, and that's the only means of communication in villages, with the cities, and even outside with so many people who are as refugees. So hence, our work is so simple on the ground that we directly connect with doctors in every province on their WhatsApp, and they send us cases from that WhatsApp or Viber to one of our coordinators, and then one of our coordinators, which it has been myself for the past few years, we allocated to one of the specialists in the UK and one of the other European countries, in the US, now even in Australia. And then the response comes back to the coordinator and then sends it back to Afghanistan. If there is a need for direct video call or a phone call, that can happen as well. And in the process, now we have contributed to saving about 700 lives between 2016 and 2019 in Afghanistan. But our work also exists in Syria, in parts of Africa, as well as helping throughout COVID pandemic in Afghanistan and India. And we are giving our template away to organizations such as World Health Organization, MSF, just to show some of the simplicities of how you can work in conflict zones. You absolutely rightly said that there are so many cultural issues and so on. And we give them those experiences as well, how to deal on a simpler way with doctors directly on the ground to be able to help.
And Dr. Arian, from my understanding, telemedicine is particularly relevant in your specialty of radiology, if I'm correct. What are some of the other specialty areas in Afghanistan where telemedicine has been particularly useful in your work?
So our work provides support for emergency departments, intensive care, as well as mental health. So these are the two fronts where lives need to be saved. But telemedicine can be used in any specialty. In Europe, we have seen the increased usage of it, especially throughout the pandemic when people haven't had or couldn't go directly to the hospital. The general practitioners have had to use it. And this is something that the European countries and the rest of the world, I think, should really adapt a lot more. Of course, it doesn't replace that face-to-face interaction or that face-to-face direct visit as well, but it can replace many visits in which the patients are not required to attend. So going forward, it has to be that synergy between face-to-face as well as remote consultation. And I have to mention that mental health is an area that I'm very passionate about, simply because when I came to the UK age 15 as a child refugee with no family support, hardly any education, and $100 in my pocket, I also brought with me the scars of conflict in form of post-traumatic stress disorder and anxiety. The prevalence of PTSD and depression, anxiety is so high in conflict zones. But also throughout the pandemic and after the pandemic, we have seen a lot of rise of trauma, mental health issues in developed countries as well. And this is an area that's not solved. It's a problem that exists here because simply, one, we don't have enough resources. Secondly, we're not tackling it properly as well. The standard of care for mental health provided in the UK or other countries that I have witnessed myself is not really that great. It really requires a proper assessment, a very holistic approach of mind and body, for which I'm working on a solution called Arian Wellbeing at the moment to help people. And that's something that going forward is one of my missions, to support people in conflict zone as well as in developed countries.
And speaking of those more long-term missions, Dr. Arian, telemedicine is, of course, an enabler to improving access to healthcare, especially in conflict zones. But the core of sustainable long-term care is really the infrastructure and the personnel available of providing that long-term care. Do you think that the Taliban will develop a commitment to that, or has the capacity to respond to these needs, especially given the growing exodus of people leaving the country?
So it's really important for us to understand the humanitarian needs on the ground and differentiate that from a political engagement. I've seen it firsthand myself of how isolated the country was during the civil war. Everything was destroyed, and later on when the Taliban took over, the country was isolated. And people were actually punished at that time. Hence, it's very important to know that when we withhold aid, humanitarian aid, we're actually punishing the people there. Their needs, such as food, shelter, medicine, or the basic necessities that you need to be able to just live. These are the things that people they don't take for granted. This is the simple things that people need in Afghanistan on a daily basis just to be able to survive from one day to another. So hence the international community should not abandon Afghanistan. There should be a humanitarian engagement on the ground. Telemedicine or our work is complementary. It's one aspect of it, but there is so much more that's needed on the ground. There are humanitarians needed on the ground. There's the aid that's needed on the ground. And I hope the Taliban will continue to engage on that front where the Western community and the Western community have to help people. Otherwise, people will die. As an example, 15 million people in Afghanistan are living through poverty, sadly. And more than 3.5 million people are displaced just to neighboring countries. And so many other people will be arriving on our shows, whether we see it in Europe, in the US, or in the UK. And that's when we have to support refugees as well, because they flee for their lives. They flee because they have no hope left for them. And hence, I hope that Taliban will start rebuilding that structure and form an intra-Afghan government of some sort, because ultimately it's up to the Afghans to decide their future. There is no military solution to Afghanistan, but it does require a lot of support and help from around the countries to be able to let Afghanistan flourish and just be a peaceful country.
Dr. Waheed, your work is certainly contributing to that. I'm so sorry to cut you short, but that's all we have time for now. Thank you so much for your work and for your time for coming on the show today.
Thank you so much for having me.